Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And today I'm chatting with Dr. Nancy Byatt about her upcoming presentation titled Promoting Maternal and Child Health, Preventing, Identifying, and Managing Postpartum Depression. Thank you so much, Dr. Byatt, for spending time with me here today.
You're welcome. Happy to be here.
And promoting your title here, if I read that one more time, promoting maternal and child health, preventing, identifying, and managing postpartum depression, that is such an important topic. And I'm very glad you are presenting about it and shining more light on the matter. But before we go into the topic and the presentation itself, can you tell us a little bit about yourself and your professional journey?
Sure. So I'm a psychiatrist, and I specialize in working with pregnant and postpartum women. And the reason I got interested in this area and really have dedicated my career to this is because when I was in training, I was working with a lot of pregnant and postpartum women, seeing them as patients. And after my residency in psychiatry, I specialized in providing psychiatric consultation for other medical providers, and namely obstetric providers and also midwives, and really working in obstetric settings, or settings that working with pregnant and postpartum women. And it really struck me that there was a lot of women that depression during this time period was extremely common. However, that the obstetric setting wasn't really geared to be addressing this. It wasn't necessarily something that perinatal healthcare professionals were trained to do. They didn't necessarily know how to ask about it. It really hadn't traditionally been sort of considered a part of what they were, their role in caring for women, including sort of all the professionals who work with pregnant and postpartum women. And so I really saw this as sort of a missed opportunity because, women during pregnancy and the postpartum period are working so often with many healthcare professionals and paraprofessionals, and it really seemed that if we can build the capacity of other professionals who are working with pregnant and postpartum, other than the mental health care professionals, that we could really be able to kind of change perinatal care so that it includes emotional health. And so that's really been what I have been dedicating my career towards, is really with the larger goal of redefining women's health so it includes emotional health. Because ultimately, for a woman to be able to take care of herself, her baby, she also needs to be able to take care of herself during all the sort of reproductive phases of life.
Absolutely. Absolutely. And I like what you said there about the missed opportunity that we can, if there's a way to build capacity for healthcare providers to support these women, that would be great. And I think you brought out there a very important point when you mentioned the other healthcare professionals that are not in the field of, they're not mental health providers, that often they feel very intimidated. They feel like they're not very educated on the subject. And at least we get to the point now that we know postpartum depression exists. It's real, and and healthcare providers are acknowledging it, but often feel very, very powerless and a little bit intimidated when it comes to the topic. So speaking to that, and maybe a little bit about insight from your side, what can you say to that, and also what kind of barriers have you encountered in your work?
Yeah, and I think so. What you just sort of noted, it is one of the barriers is that I think there's two barriers. One is that mental health care there will never be enough mental health care professionals to see all these patients, particularly those who need medication treatment. That's kind of one big piece. And then the other piece is that there isn't enough mental health professionals, particularly those that are able to prescribe if medication's treatment indicated. So, and then you have that combined with that the other healthcare professionals who are seeing women aren't necessarily trained or have the resources to know how to manage it. And you said it can be very, very intimidating. And actually, even mental health care professionals can also be timid, even if they are trained in psychiatry or mental health. They can sometimes be intimidated by working with pregnant and postpartum women due to this sort of complicated decision making, particularly around medication treatment during that time period. So that's what sort of led to this. My sort of mission and my work has focused on helping the perinatal health care setting to be able to address that, and also building the capacity of our psychiatric colleagues to be able to make evidence-based decisions to work with women during this time period.
Very good, and I'm very interested in your presentation. I can't wait for it and learning more about what we can do in the field. Before I let you go, can you tell us a little bit, without giving too much away from your presentation here, what you would our delegates like to take away from it?
The main piece, I think, is that there is no health without emotional health. That it is women to be, and that getting that women taking care of their emotional health, and sometimes that includes psychotherapy, medication treatment, depends on the circumstance, is the best thing they can do for themselves and their baby. And as the healthcare and as perinatal healthcare professionals, that it's such a critical part of providing that care to be able to integrate emotional health as a routine part of perinatal healthcare. Because ultimately, to optimize maternal outcomes, emotional health and mental health really just needs to be a part of that.
Well, thank you so much, Dr. Byatt, spending some time with me and chatting about the upcoming presentation, Promoting Maternal and Child Health, Preventing, Identifying, and Managing Postpartum Depression. This presentation is part of the Gold Perinatal Online Conference 2017, and the presentation will be live on October 11th. For more information on this presentation and when it's being held in your time zone, please visit www.goldperinatal.com. Thank you again, Dr. Byatt, for speaking with me today, and thank you to all our listeners. Bye-bye.